Well, hello, DMV. Jackie Paige here with another session of Girl Talk Live. I have absolutely enjoyed doing this, and today's Girl Talk will be very, very interesting and much needed because it is Breast Cancer Awareness Month. There is a lot that we need to dig into as women, especially Black women, because in Prince George's County, Black women have a higher incidence rate and mortality rate for breast cancer than white women in the county and Black women in the rest of the state. But breast cancer diagnosis doesn't have to be a death sentence, okay? It's something that you can figure out. It is something that you can live with and get past. And that's what we want to talk about today. So, the treatment, what it is, just really dig and dive into everything when it comes to breast cancer. I cannot have this conversation with myself. So, I am so excited to have, first and foremost, Miss Katerina Tsiapali, MD, FAC, fellowship trained breast surgeon, director, comprehensive breast program at Capital Region Health. How are you doing today?
Doing good. Thank you for having me, Jackie.
Thank you for joining. I know you're going to have a lot of great insight, so I can't wait to start talking to you in a few seconds. Also joining today, we have Miss Vikisha Fripp, MD, FACS, board certified plastic and reconstructive surgeon, co-chief, Capital Region Surgery Center, medical director, chairman, Department of Surgery, Capital Region Health. How are you doing today, Dr. Fripp?
I'm well. Always good to see you, Jackie.
Likewise. All right, ladies. So let's just go ahead and get into it. It is Breast Cancer Awareness Month. And we need to talk about this because it's something that all women deal with, and it's something that Black women are dealing with and they're dying with a lot more than some of our counterparts. So just want to ask a really generic question. And Dr. Tsiapali, I'll pose this question to you. What exactly is breast cancer?
So, breast cancer has a lot of different shapes and forms. It is basically an abnormal growth in the breast that usually comes from the milk producing tissue of the breast. And we have that at any age, whether women are breastfeeding or not. And that's where a lot of those basically the cells go wild and they stop, the body cannot control their growth, and that's when a tumor develops. There's a lot of different subtypes. Some, less aggressive, others more aggressive, more fast growing. But that's the basics of it.
Thank you for giving us that explanation because a lot of the time some of it is just really understanding what it is. So how is that something that we as women detect? Is it something we can do on a daily basis, on a monthly basis, to see if we have breast cancer?
hmm So keep in mind that breast cancer is more common as we age. So the more common ages where we see those diagnoses are in women in their 50s and 60s. It can happen in older women or younger women, but not as frequently. And then the best way to find breast cancer is by doing screening mammograms. There's a reason we keep harping on that because it really works. And it's one of the ways we have to decrease mortality, to prevent women from dying from breast cancer, is by doing frequent screenings. So that's the most reliable way, doing your screening mammogram once a year, unless there are high risk factors in the family or in yourself that you need to screen more frequently. But for most women, once a year is enough. Then outside of that, women can feel around in the breast and feel any lumps or any look for any rashes, any discharge from the nipple, things along those lines. And that is usually enough to do it once a month or so. In sort of a neutral part of your cycle, not if you're still menstruating, not when the breasts are really swollen and painful right before your period. Just pick a time when they're more quiet, so just so it doesn't give you a false alarm.
At what age should we start giving ourselves breast examinations and actually going in to get an exam?
So I think that once the breast develops, so in the late teenage years, that's a good time to sort of familiarize yourself with the breasts, kind of know where your denser areas are, kind of know where everything is, their shape and size and consistency, and that changes in our lives. But around the late teen years is a good time to start self breast exams. And then usually most women, when they start going for their gynecology exams, they get a breast exam as well. So around the late teens, 20s,
Mhm.
is a good time to start.
Okay, so you don't have to wait until you're in your 40s or in your 50s to start this exam. This is something that should start very early on in life.
Right. Again, we don't worry about breast cancer until later,
Mhm.
but some benign lumps can occur earlier in life as well. So those are good to find.
So, question: if somebody in your family, let's say your mother, your grandmother, had breast cancer, and you're in your 20s, should you consider getting an examination a little more often than somebody who doesn't have a history of breast cancer?
That depends on two things. What age the family member had breast cancer. So usually we say, let's go back 10 years from that. So if you have somebody in the family who had a breast cancer at age 40, I would start on around age 30 with having more exams and being a little bit more cautious. And then the other thing is whether there has been any abnormal genes identified in the family. If that is the case for some of the high risk genes, then we start screening maybe at age 25 or earlier, even sometimes.
Okay. Good information to know. There's so many different treatments, and we hear and we see about the different treatments for breast cancer nowadays. Why are African American women dying from this more than other ethnicities? Uh, Dr. Tsiapali?
Well, that's the $1 million question. And I think there's no simple answer to that. I know I have developed a lot of my practice working in Prince George's County and working with African American women and try to figure out what we can improve on. And I think that we know, first of all, that African American women develop some more aggressive forms of breast cancer more frequently. That's biology, and I'm not sure that we can interfere
Yeah.
with that as much. Um, the other thing that I have observed and studies have shown is that sometimes they choose not to screen as frequently or adequately. Screening is great, but you also have to go to a nice, reputable place to have a nice technology, have a nice reading, interpretation of the imaging of the exam for it to be worthwhile. Then there's a lot of barriers, sometimes socioeconomic, financial reasons, social reasons. Women seem to kind of have the brunt of taking care for everybody in the family, and they can neglect themselves. Um, Sometimes not having good access to care or access to good care, which is what we're trying to improve here,
Mhm.
just bring quality care in the region. And also, one of the things that I think keeps African American women behind is that they're not very well represented in research trials. So that's where we're researching new medications, new ways to treat breast cancer. And if we don't have a good representation of African American women, we don't know if those treatments work the same for them as they do for other ethnic groups. So even though I know there's a lot of barriers and access to those trials, I encourage everybody who's hearing us to make themselves available for trials if it's applicable.
Yeah, it may not necessarily impact you, but it could impact a generation or two after you. And
Absolutely.
to your point, like we want to make sure that we take care of not only ourselves, but and women, that's what we do. We take care of ourselves, but taking care of those generations after us. And one of the ways that you can do that is, participating in the trial so that more research can be developed so that the care and the access is there. Speaking about treatments, 10 years ago, surgical treatment meant radical mastectomies and disfiguration. Is that still the case in 2021?
Oh boy, no, not if I have to say anything about it. Absolutely not. I think as a group of surgeons, breast surgeons have really tried to pay attention to cosmesis, make it along with the help of our plastic surgeon colleagues, but to make sure that we give women options.
Mhm.
So radical surgery is something that we hardly ever do these days. If something a tumor presents at an advanced stage, it's really large, there's a lot of lymph nodes involved. Usually we start with medication to try and shrink it so then we have more options in by way of removing it. We have evolved to doing nipple sparing mastectomies, where we preserve a lot of the skin envelope of the breast so the reconstruction looks more natural. We have more options as far as lumpectomies, which is just removing the area of the tumor. And we can offer that for larger tumors or tumors that are in multiple areas in the breast. So most of the times women get a very good cosmetic result after treatment. So radical surgeries should be out.
Dr. Fripp, do you want to add to that about the radical surgeries that we were once seeing 10, 15 years ago?
I think it's unacceptable. That's all I have to say. We have so many other modalities now, and what we can do is when women have larger breasts, we actually pair with the breast surgeon to do a reduction at the time, or we do a manipulation of the tissue, and we call those oncoloplastic procedures, which means we're dealing with the cancer, but we're using our plastic surgery techniques to make the breast look better. And so most times you can have either a breast surgeon who is trained in those techniques, because sometimes they can do that on their own, but oftentimes they have us coming at the same time that the breast tissue is being removed. Even if it's a large portion of the breast, you can still tailor the portion of breast tissue that remains so that it looks like a breast and it's not left with a big defect.
Question. This was just 10 years ago. Why was, mastectomies and disfiguration a big thing 10, 15 years ago? Why wasn't there other options available? And I don't know if you ladies can really speak on that, but I mean, it's just something that, I understand technology does improve over time, but I mean, it was literally just 10 years ago.
I think I'll start with that. I think part of it was that we didn't have in the past a lot of other effective treatments.
Mhm.
Surgery had to be more radical. We didn't have any medication that were appropriate to what we call downstage the tumor, make it shrink. Now we're doing so much better at that, and there's a lot of different options. And I have to say, special having surgeons who specialize in breast surgery has made a huge impact on that as well, and partnering with the plastic surgeons. There's and I have to say, we're breaking the glass ceiling as breast surgeons. More women are part of our societies, so we bring a little bit of that female touch and female consideration of how the girls will look after
Yeah.
surgery. So I think all those things, specializing, having more women involved in this type of surgery, and having better treatments has helped a lot.
Hmm. Dr. Fripp, anything you want to add?
Asking for better, right? So we have patients who are more knowledgeable now. They want better. And when a patient leaves the discussion, things tend to move a little bit faster. And so patients are saying, I don't want that incision across my chest. Is there anything else that can be done? And when those questions come in, then we match the questions. Science typically matches the ask, right? And so we have technology that has advanced, like Dr. Tsiapali has told us, that can now match what the patients are asking for, that minimally invasive type approach.
Yeah. I think it just kind of goes back to the point that Dr. Tsiapali was making not too long ago about getting involved in the trials and research, because we don't know until we don't know. And if
Right.
you're not a part of the research, and if you're not out here speaking about what you want and how you want it to be done, then, things can't advance, things can't grow and get better. So thank you, ladies, for sharing that. It was just something that literally just popped in my head, and I'm like, it was only 10 years ago. How is it that we have advanced so much? Speaking of the different treatment options for breast cancer, are there different treatment options depending on what when your diagnosis is? Dr. Tsiapali, I'll let you take this one first.
Absolutely. I think there's no every treatment has to be individualized. It depends on the patient's age, on the patient, the features, what other medical problems they have, and the most significant thing is the staging of the tumor, how big it is, and what type of tumor we're dealing with.
Uh-huh.
For a lot, the most common cancers are usually hormone sensitive, so we have good options of treating them with anti-hormone pills along with the surgery and usually the radiation. We have managed over the last years to cut down significantly on the number of patients who are getting chemotherapy. That used to be very common even about 15 years ago when I was starting in this field. Most patients got chemotherapy. Now that's hardly ever necessary for some types of tumors. And then we're still getting good results though because we're treating the tumors more in a more appropriate way rather than just being aggressive without a specific target. So there's a lot of good treatments and a great outcomes, which makes my daily life much more pleasant. I like to give people good news.
I'm sure, and I'm sure a lot of your patients like to hear the great news. So I can completely understand. Um, so talking about some more of the surgeries a little bit that are part of the treatment process, we hear a lot about lumpectomies today, which can be as disfiguring as mastectomy. Is reconstruction an option when just a part of the breast is surgically removed? Dr. Fripp, I'll let you take this one.
Yes. I think it should be a consideration, especially if you're talking about removing breast tissue from the upper portions of the breast. Even as little as 30 grams of breast tissue can cause disfigurement of the breast itself because the tissue heals, it either contracts or there can be a depression in the tissue in that area where it was removed. And so, what we do is evaluate where the tumor is in the breast, and that allows us to know how or if reconstruction is necessary. It could be as simple as placing a small tissue expander to hold and tent the skin out while it heals. And then you remove the tissue expander afterwards, not needing to do anything else to the breast, right? But while it heals, if it can be tented out and held out, then there will not be a concavity or depression that develops. And so, again, we just have to know that when we go into it, we have to make sure that we're prepared for things that could happen, right? So people often say, well, I'm only going to remove a small amount of breast tissue. But again, if that's a B cut breast, what you consider to be a small amount could be the majority of that breast, right? Even if it was a double D, triple D cut breast, if it's being removed on the superior portion, the area above the nipple areola complex, it can make a significant deformity of the breast.
That's really, really good information to know. We're talking about the different options for treatment. Let's talk about the actual recovery process when it comes to treatment. So, Dr. Fripp, what is the recovery process? Because a lot of us women, we don't like to be down and out for a very long time. We have families to take care of, lives to live. So, what's the recovery process?
That's a great question because when I go through the steps with patients about what their the reconstruction options are, I always say the number one option is to do nothing because it might be overwhelming at the same time, right? You're dealing with a new diagnosis. You still have a life that requires your attention. And sometimes we have patients to go out, and when it becomes a better time for them, when they've made space, when they are ready, then we do the reconstruction because there is a recovery period. If we do what we call implant-based reconstruction, that tissue expander is placed at the time that the breast is removed. Typically, that patient would only spend one night in the hospital, but the discomfort that you would feel may last up to a week, right? We also place drains at that time of the tissue expander placement. And so you may not feel comfortable going back into work. You may not feel comfortable being at church. You may not feel comfortable being outside your home with a drain attached to you. And so that recovery period, though you're not down and out, you're not able to be 100% of what you were until that drain is removed. And that could be 2 or 3 weeks after surgery. When we do more of the tissue rearrangement, pulling tissue from the abdomen, rotating tissue from your back to create a breast, that requires a longer hospital stay after surgery and up to 2 weeks where you're what we consider to be down because we don't want you to do a lot. We're not operating on your arms and your legs and they move. I always tell people get up and move. But at the same point, I don't want you doing too much because I've moved tissue from one portion of your body like an auto transplant, right? So I want you to take it easy for a while. And so people may not have 2 weeks to be out and away from their daily tasks. So we tell patients prepare for multiple surgeries. First of all, reconstruction is never done in a one. We have what we call single stage surgery, but even when we do single stage surgery, patients should be prepared to need what we call a touch up, right? Just to make sure it is where we want it to be. Sometimes we need to do a little nip and tuck afterwards. So it's multiple procedures and it can be a prolonged period of time that you're without 100% engagement into your activities, but it's something that's well worth it. It's well worth it. And in our practice, and much like Dr. Tsiapali, we hold our patient's hand because we're in this together. This is a partnership, but you need to come with your half. Dr. Tsiapali and I, we have our half. I want you to come with your half. And that is, if you can, as much as you can, round up these people to be your support system during this time. Don't be afraid to ask for help, and don't be afraid to say no.
Yeah. Dr. Tsiapali, do you want to add anything to the recovery process? How long could it or it could not take? Because I don't know, whenever I think of breast cancer and reconstruction in my head, I'm thinking, be down and out for a very long time.
Like Dr. Fripp, I completely agree with her. I always tell my patients, it's like preparing for the marathon. You have to bring your A game. You have to make sure your body is healthy. I know we don't have a lot of time to prepare sometimes. You want to make sure you eat well, you stay away from alcohol, you stop smoking, you exercise and get your body as flexible as possible leading up to the surgery, so then you can continue to work with your body to get better. It is sometimes a big investment up front, especially with those larger reconstructions, but those give you nice long-term sustainable results with good cosmesis, good looking good, and that is worth it. And I think that it's definitely doable. It just needs careful surgery, careful execution, and for the patient to stay on it afterwards and before.
Now, different stages will allow you to do different things, correct? Or have a different recovery process. I heard you mention, like, depending on where you are, that depends on like how much time that you have. So, and Dr. Fripp, you said this a little earlier that, sometimes patients can go home and spend some time getting themselves together and kind of planning when it works best. What stage is it when it's just like, hey, you know what, this is something we have to do immediately? Is that stage 4? Is that stage 3? Can you shed some light on that?
So I think the urgency to go ahead with treatment depends a little bit on the type of the tumor, how fast it moves, how fast it grows. Some don't give us a lot of, leeway. Even a few weeks can make a big difference. Others can be there for 6, 7, 8 weeks, 3 months, and nothing happens. So we have our time to make our plan and get all our information together and plan appropriately. So it all depends on that. And then the recovery depends on, from my end, before we get to the reconstruction part, it depends on how much of the breast tissue is going to be removed. A smaller surgery, obviously easier recovery, as opposed to a larger excision or a mastectomy with reconstruction.
Okay. If only one of the breasts is affected, what do you do to make sure that the breasts are even after surgery? Because we don't want anything lopsided. So what are some things that you do to make sure that we're together? And I heard Dr. Fripp mention a little earlier, like coming back a few times, but what does that look like?
So for me, it depends on what the patient wants. Sometimes if a patient has a smaller breast and she's having a mastectomy, she says, you know what, I've always wanted my breast to be larger. And so we have the chance to do that. So we place a tissue expander on the side where they were treated with the cancer, and then we augment both breasts. So we put an implant in both breasts. Clearly the side with native tissue would have a smaller implant. But people decide, you know what, I think this is gonna be the time in my life I'm gonna get the girls I wanted. Other times patients say, you know what, I wanna be the same exact size. So I don't want you to adjust anything. I wanna make my non-treated breast look like this one. And so we reduce the opposite side so that they are the same. And then we run into the problem with patients who come in and they have major asymmetry. And it happens, right? Yeah. One breast is just that much larger than the other. That's when we really get into the discussion with the patients about what they want. Because if that is the case, we may be able to do something at the time of the mastectomy, right? If they're that asymmetric before, and we're going to do something about the breast that has cancer, then we may be able to do something about both breasts at the same time once the decision has been made about what they want. So it's really guided by whether the patient wants to be larger, smaller, or about the same. And we use that guide when we go in. But most of the patients say, I want the girls I've always wanted. I want them up as much as they can be up, and I want them as full as they can be.
Completely understand that. If you're gonna do it, might as well just go ahead and get it done.
Well,
Makes a lot of sense. We're seeing breast cancer in younger women now. Can a woman still have a child and even breastfeed after she has had breast cancer and gone through surgery? Uh, Dr. Tsiapali, I'll let you start.
Yeah, I'll take that on. And actually, that has been a research interest of mine, preserving fertility, giving the women the opportunity to continue to be able to have children after a breast cancer diagnosis. So it depends on what treatment we will use for breast cancer. I think the major offender is chemotherapy. That's what can age the ovaries and kind of take away your capability, a woman's capability of having children. So we knowing that, depending on the patient's desires and their age, there's some things that we can do before we start the cancer treatment. Usually that is accomplished by harvesting some eggs and freezing them. So you have your little safety deposit there. So you can use those down the road if women want to have children. If chemotherapy is out of the picture, then some of the pills that we use for treatment of breast cancer, it's also contraindicated to get pregnant while on them. But now we know enough that sometimes we can give the patient a break from the treatment if it's safe. It has to be a one-on-one discussion
Yeah.
and allow them to get pregnant and then resume the treatment. So definitely that's one of the things I always ask my patients up front. What are your plans? Do you want more children down the road? Let's plan for that if that is in the cards for you. That is something that's on your mind. As far as breastfeeding, definitely the breast that's not affected and has not been operated on functions normally. And you can, yes, you can breastfeed just from one side. It may look funny, but it definitely can be done. If the other breast has been removed, obviously no option for breastfeeding there. And definitely, even if a lumpectomy has been done, especially with the radiation, sometimes that breast, even if it's there, may not be a big milk producer, or may not be able to breastfeed from that, depending on where the incisions and the cancer was.
Yeah. Good information. I honestly didn't know that you could still give birth, have a baby, and even breastfeed after a diagnosis of breast cancer. So that is something good to know. That although you may get this diagnosis, it doesn't mean that life stops right here. There are different ways and different means to continue to live your life and live your life to the fullest. Ladies, what is the prognosis for Black women? And how do we bring down this mortality rate? Dr. Fripp, I'll let you take this one first.
So I'll let Dr. Tsiapali talk about the mortality, but I think that the truth is it's more than just education. It's prioritizing. It really is. And I think we have to take away the stigma that doing something for yourself is somehow bad, that we are somehow less than our male counterparts. I have never suffered from thinking that. And so I instill that into my patients that you will always be busy. I mean, I'm always busy. I don't know a time when I'm not, even when I'm about to prepare for sleep. I'm busy thinking about what I'm going to do the next day, or have I accomplished all the things I want to do in this day, right? But you have to carve out time for yourself. And when you prioritize your health, then you can be a better person and show up in every other area of your life. If you are your best version, then that's what you give other people, right? So if you have no idea how your breasts feel, and you're waiting for that every year when you see your OBGYN for them to tell you, you've missed the boat. You missed the boat. So I ask patients all the time, what's your birthday? And they tell me, and I say, on the day you were born on, I was born on the 16th. That's the day you do your breast exam. Now, again, if you are about to have your cycle and your breasts are tender, then you want to put it off so that it's not uncomfortable. But you have to do little things. See, those are little steps to prioritize your health, saying that every month on the 16th is my holiday. It's about me. Right? Not just on the month, but the date. So if we prioritize our health, then we put ourselves first. We get the screening that we need. We know when something feels abnormal, we're the person telling the doctor this is not right. They're not telling us for the first time, right? And so it's not about education. I think we've done a good job with education. We just have to do it, right? We've taken the horse to the water. We need to put a straw in the mouth You just need to suck up, you follow me, and then go and be amazing. Because we have the opportunity to be great. Like we made it through a pandemic, so we're not going to be average anymore. And I don't really know what that means anyway to be average. But we have made it through the worst, and this is our time to really prioritize our health. And then we have the opportunity to have all these wonderful people like Dr. Tsiapali is right down the street for people in Prince George's County. No longer do you need to leave the county. She's right there and she's open for business, right? So you have all this good stuff waiting for you. Do something with it.
Yeah. And great tip right there, because I will say I do fall in the bucket of whenever it pops up in my head, I'm like, oh, I forgot last month, or oh, it's been 2 months, let me do a breast exam. But I do like that tip of on my birthday,
Yep.
on the 9th of every month,
Yep.
doing a breast examination, because like you said, we have to take time for ourselves, and we just get so inundated with life that we just forget to do stuff like that. And I have to say, I fall into the bucket of I forget to do it every month. It'll be 2 or 3 months down the line, and I'm like, oops, kind of forgot. But that's a
Make it your own personal holiday every month. Like that's just your holiday. Look at you.
great tip. Is there, talking about doing the exam, is there like a particular, and I've heard like do it in the shower, or, do it while you're laying down in the bed. Is there like a particular place that is best to do the examination? I know when you go into your actual doctor, you're usually laying down on the bed. So talk about like that breast examination and that you can do at home, and like the best place, since we're talking about, the best time of month to do it.
Mhm. I think the best, whatever works for somebody is the best way to do it.
Mhm.
I think the reason we have people laying back and is to make the breast flat as possible, so we can feel deeper. So whichever way you want to accomplish that is absolutely fine. Just make sure you cover the whole area, the whole breast. Check under the nipple, check under the arm. And I like the shower because your fingers are nice and soapy and can glide a little bit better on the skin, or use a nice thick moisturizer and use that after the shower. Whichever way you want to do it is fine.
I like it. I love it. Different options. So whatever works best for you, and use the tip of on your birthday. Dr. Fripp, thank you so much for that, because I fall victim all the time. I'll let months go by and I'm like, oops, I meant to do this, but life has just gotten the best of me. I want to take it back real quick and get your opinion on this, Dr. Tsiapali. What is the prognosis for Black women, and how do we bring down this mortality rate?
I think the most important thing is not to be afraid. And breast cancer is rarely a death sentence these days. We have so many good and effective treatments that it's all a matter of staying on top of it and just talking to your doctor about it. I think that is the most important thing. And I want to stress to women not to disregard something that is going on. Um, we have video visits these days. We have our doctors at the tip of our fingers, or the screen of our phones. So use that service. What's the worst thing that can happen? It's nothing.
Mhm.
So that's great. I would say get your mammograms consistently. Make sure you get frequent breast exams, and just don't be afraid. If something worries you, if something doesn't feel right, just bring it forward. It always helps to catch it early.
Mhm.
um, and I think that is the best way to stay, bring those mortality numbers down. Take good care of yourselves. Women have to get out, put the guilt aside. We have to take care of ourselves. We have to exercise. We have to keep a balanced, healthy diet. We have to enjoy our lives and put stress down. Everybody, we're needed. We're very important in the family life, our friends, family, everybody, our work. But in order for us to do all those things, we have to be okay with ourselves and we have to be healthy. So always keep that at the front of our minds.
Yeah. And to your point, stress will bring on a lot of different ailments and illnesses in our body. So, as a personal trainer, I love when I can get a second to say, yes, eat healthy, get active, get moving, and take time for yourself, because it's important. A lot of people are just like, oh, well, exercise is just for losing weight. No, it's not just for losing weight. Eating healthy isn't just for losing weight. It's for so much more, including, like you said, making sure that we're taking care of all around. Ladies, let's end on a positive note. What is the good news for Black women and breast cancer? Dr. Tsiapali, I'll let you start off.
Yeah, I will say that again, we have made so much progress with our treatments. Mortality rates from breast cancer all over have gone down by 40% in the last few decades. So most women who are diagnosed with breast cancer live long and happy, productive lives with great quality of life. So keep that in mind. Our goal is to make this another problem like your blood sugars or your blood pressure that you have to take care of, but doesn't limit who you are, doesn't stop you from living your best life.
Yeah.
So don't be afraid to tackle it head on. Women amaze me all the time with how strong they are and how much they can really take on and get on the other side, looking wonderful.
Yeah.
So don't be afraid. It's a manageable problem. Make sure you stay on top of your breast health.
Yeah. We are very resilient. Dr. Fripp.
Mhm.
I think the good news is that we're here, especially for the ladies of Prince George's County. I mean, you don't have to worry about moving and going outside your area. If we cannot provide those services for you, we are a part of a network. We're not operating within a vacuum at CAP region. So we have access to our colleagues up in Baltimore. We have access to our colleagues who are all around us. And so you don't have to worry, how will I get to this appointment? Where is this office? Where will I park when I get down there? And I live in the District of Columbia, and I love it. But if you don't live here, it is a struggle when you come here, right? And so you don't have to worry about that. We are centrally located in Prince George's County, and we're knowledgeable. Dr. Tsiapali is a fellowship trained breast surgeon. I'm a board certified plastic surgeon. And what we don't know, we don't have a problem saying, and we don't have a problem getting access to it for you. So that's the good news locally. Globally, the good news is there's so many plastic surgeons out there who are well trained in reconstruction. You have to get off the internet and into someone's office, right? The internet is full of information, but until you hear it from somebody who does it, that information is just opinion, right? And so I see a lot of people getting their information from the internet and from their friends. And while that's always wonderful to go in with questions, you need to get into someone's office who is a board certified plastic and reconstructive surgeon so they can tell you what is appropriate for you.
Mhm.
And if you feel uncomfortable at any point, you ask them for the name of someone else they can see. Because we're not offended if you get a second opinion. You just need to feel comfortable. So that's the great news. We have a lot of plastic surgeons now. Our numbers are increasing in every area of the country, but locally, you have Dr. Fripp and you have Dr. Tsiapali.
I'm happy that you brought that up. If there is a woman watching right now and she's dealing with breast cancer, she's in the treatment phase, and she doesn't like the doctor that she's working with currently, if you're already in a treatment phase, can you change doctors?
I'll let the Tsiapalis talk about the breast cancer treatment phase.
Yeah, absolutely. It's not ideal. I think it's always good to stay with the people, but it's a relationship,
Mhm.
and like every relationship, there has to be chemistry.
Right.
Some people love me, some people hate me. It is the nature of our personalities, and you should feel very comfortable with your doctors. And there's nothing we haven't seen before, we haven't dealt with before. And we can definitely you're not married to anybody. I say we just have to keep working towards this relationship, and it's appropriate to do that if you're feeling uncomfortable.
Okay.
I will say this though, before you break your treatment, just be vocal about what the issue is, right? Because I often ask patients who come to see me for a second opinion, they all love me. But I often ask them when they come in, did you tell your doctor this? And they say, well, no. And I'm like, well, remember, we're equal in this relationship. So it's okay if something happened, give them the opportunity to explain it to you or potentially, quote unquote, make it right, right? Because no one goes into this wanting to harm a patient. There is nobody doing this work who wants to harm you or make you unhappy. That does not exist, right? So if you have a concern, tell your doctor first. Now, if you don't think it was received well, or you didn't get the answer you were looking for, or persist, then you can go into the American Society of Plastic Surgery. They have American Society of Breast Surgeons, and look for your zip code, another surgeon, or who could potentially see you, right? But give the doctor the first chance to know about it and potentially make it right.
Great bit of advice, because sometimes we would just shut people out. We don't even give them the opportunity
You
to speak.
know, yeah.
Great bit of advice. Ladies, before we wrap up, I just want you both to just leave a lasting message for anybody that's watching right now that may, like I said, be dealing with breast cancer. They're in like a stuck place. They don't know what to do, where to go. They're a little depressed. They need some inspiration. So, having you both on here, both certified, both have worked with a number of different patients and have seen them through the entire process and then some. Just give the ladies something to go off of so that they don't feel like they're completely lost. Dr. Tsiapali, I'll let you start.
I want to say that nobody's alone. I think one of the first things that I did when I started this new practice was hire a supportive staff, including nurse navigators, a social worker, because that's where the battle is lost sometimes. So there are
Mhm.
resources out there. You just have to ask. And just women are strong, they can handle it, but they don't have to handle it alone. So use us, use our resources, and we'll hold their hands throughout this process.
Mm, love it. Dr. Fripp.
So I tell people all the time that nobody wants breast cancer, right? So we know that 1 in 3 will get it, but no one raises their hand to say, I want it. And there's nothing you can do outside of your risk factors, right, to prevent you from getting it. It dropped on you for whatever reason. So you didn't do anything bad. You're not a bad person, and that's why you got breast cancer, right? You may have some genes that made you more predisposed to getting it. Maybe certain environmental factors led you to here, but there's nothing about you that made you get breast cancer. It's not a punishment in that way. So that's the first thing to dismiss that. Dismiss it. And if nobody asked for it and you got it, then what we have to do is fight. And I mean fight. And a part of every fight is getting your mind right. Before you prepare for anything, you have to know that I'm in a battle and that my goal is to win. So that I'm going to do everything in my power to achieve that goal. So having yourself paired with a surgeon who knows you, all the support system. Dr. Siapli's team must be 50 deep. I'm just saying that because I'm jealous. But she has a team, and you need to get with a team and let them know you by name, right? So we're here. That's the good news. And so you didn't want this. Nobody wants it. You didn't deserve it, but you're here, and we're going to fight. So today may be cloudy, but guess what? I never know. I always bet on tomorrow because I never know what it's going to bring. And I'm an eternal optimist, and I believe good things are supposed to happen to me, and that means they're supposed to happen to you too.
Great advice from both of you. I am sure there is a woman right now watching that needed that, and that will be reaching out to one of you soon and very soon. So, with that being said, can you please give us your contact information if somebody wants to reach out to you directly and get some more details on what you do, respectively, as well as find out how they can possibly work with you? Dr. Fripp, we'll start with you.
So my office number is 301-809-2013. I do have a website, and it's www.drfripp.com. The University of Maryland Cat Region also has a website, and we are listed there with our contact information as well as the staff that supports us.
Awesome. Thank you so much. Dr. Tsiapali.
I don't pretend to remember it by heart, but it's exactly the same number. So we share an
We
office,
should.
and our number is exactly the same. And the same way for us through the University of Maryland website. Our names are up there, and we can be reached at any time.
I love it. And I love that you ladies just said that you share an office. And
Yep.
you can just, I mean, and we can see just like how you ladies work together and how you mesh together. And I mean, we're doing this virtually, but just seeing how you ladies work and mesh together on this. If you are watching and you are dealing with breast cancer, this right here should show you like there is a talk about a team and a village and a support system. Like these ladies are here for you. they work together. They work in tangent to make sure that you can live the best life that you can live. So, ladies, thank you so much
Of
for
course.
everything that you do day in and day out. Thank you for giving us all this wonderful information about breast cancer. Like I said, it is Breast Cancer Awareness Month, and I did want to take just a few moments to talk about it and really highlight it so that we can live and we can live full lives and move past breast cancer because it doesn't have to be a death sentence. So, Dr. Tsiapali, Dr. Fripp, thank you so much. DMV, Marilyn, thank you for joining. This has been another session and episode of Girl Talk Live.